My name is Dory, and thank you for having us.
Welcome.
I was diagnosed with breast cancer at 29 years old, and I am now 32, so a few years out, hence the longer hair.
And looks great, by the way.
Oh, thanks. I had a double mastectomy, reconstruction, chemo, radiation.
And I'm Emily, and I was diagnosed at the age of 27, 3 years ago, and I had the same treatment as Dory. I was just married for 1 year before my diagnosis, and by the time we realized I had breast cancer, we knew it was in my lymph nodes, and it had grown really fast, so we needed to get to chemo really fast. But my oncologist said, you can go to the fertility clinic, and you have 2 weeks to do it. And so luckily, I was able to start that day that I went to the fertility clinic, and I actually had the eggs out the same day I started chemo.
The reason, I'm going to give some enlightenment.
Please,
so the reason being is because chemo is obviously very invasive on your whole body, and I'm not an expert at this, but it's killing your eggs.
Yes.
Therefore, you have lower chance of having babies potentially in the future. Hence, why you would do IVF, right? It was IVF to take your
Harvest your eggs. Yes.
And make little frozen babies. For myself, it wasn't as quick as you because Emily had chemo first. I had surgery first. So in theory, I had a little bit more time to make these decisions and go through the whole IVF thing, maybe a month or so. But a little bit of a different decision was that I was with my now husband, was a boyfriend at the time, for 2.5 years. So it was a little bit of a different decision about what are we going to do, because you can either freeze your eggs or make embryos, essentially. So combine sperm and egg, make embryo. So the whole point, the difference is if you do your eggs, obviously they're mine. If anything, if I didn't stay with my boyfriend or / husband, they would be mine to keep. But then once you harvest them, they're both of yours, and that's obviously a bigger thing down the line. Also, if it's an embryo, it has more of a chance of surviving when you do the implantation.
Yes.
So it's a lot to think about. Yeah. That's the thing too. It's all of these decisions are all after a cancer diagnosis, 2 weeks prior. It's okay, not only did you get that, but now you have to make all these decisions, and one has to do with basically the rest of your life.
Yeah.
So for us, thankfully it wasn't that hard of a decision for us. We knew we wanted to be together, and
you knew you wanted a family. Let's say, right?
100%. That wasn't a hard decision, and so we went the embryo route. But another thing that Emily and I were both lucky with is that a lot of people don't get that opportunity for many reasons. One reason I've heard is because since we have hormone-sensitive cancers, they don't want you shoving needles in your
which is a hormone cures cancer
to grow which potentially will grow your tumor. So I obviously didn't know any of this stuff then, but when I talk to people after, I'm like, oh wow, so I feel lucky that A, I was informed, and B, I had that opportunity to do it before.
And it's hard because maybe you weren't thinking about a family. You were thinking, am
I
going to get married?
I know. And then you have to.
You're huge decision.
Want to make a baby with me?
Well, that's essentially, it was funny with my husband. I was like, okay, so we basically just decided to make a baby. I'm not that conservative, but I was like, you got to put a ring on it. So,
good for you.
Yeah, so we didn't he didn't actually propose that or anything, but we went to the store. I'm like, you're putting a ring on my finger. We are making a baby. This is an official thing.
This is very serious.
It's a promise ring. It's we are now, this is a thing.
And sometimes these things emotionally don't come up right away because you're in a mode of, okay,
crisis.
What am I doing next? So I have a scan today. When's radiation? When's surgery? When's chemo? And you're kind of in a planning stage, if you will. You're not thinking 10 years into the future because really, you probably were not looking at having a baby right in your 20s. You were probably thinking, I'll get in my career a little bit and then I'll have a baby, right? So it's very, very emotionally hard, and sometimes you suppress it, and it might come up later too.
So basically, I was on tamoxifen and Zoladex, both of which you obviously can't get pregnant while you're on.
They're hormone suppressing, so they suppress the female hormones and don't let your body create more female hormones, because some breast cancers are hormone-driven.
Yeah, and so my body went into fake menopause, so not real menopause, but fake menopause. So it's a little bit different because then normal person when they're deciding to have a baby, because they're not just like, let's just start trying.
Pull the goalie.
Yeah, had to go and talk to my oncologist, be like, this is what I want, what's the plan, when can I go off my drugs? And they don't want, if it was up to them, they would keep you on the drugs for 5-10 years, 10 years, I should say, without going off of it. But like, I'm like, no, that's not happening. I'm not having my first child at 42.
And good for you for advocating
Yeah.
for what your life wants to look like.
Exactly.
Yes.
So luckily, like, my oncologist was okay with it. So he said, minimum 18 months.
Mhm.
So I went off of both drugs. We've been trying, and we actually got pregnant, which was really crazy considering they said that it was going to be almost impossible. But then unfortunately, I had a miscarriage. So with the chemo and all of that, they did say that it would be a 50% chance of miscarriage.
Quite the high and the low.
Yeah, very much so. And so it's like same idea as like the cancer diagnosis. It's like it's been a whirlwind with all that. I'm thankful and lucky that I got pregnant to begin with. So just kind of
Shows
trying
that you
to.
can get pregnant.
Yeah, it
Yeah.
gives you the real hope. right?
Exactly.
Yeah, this is a good thing.
Yeah. So the only thing to note is like there's a window, because when I'm supposed to be on drugs and I'm off of them, so they're not just going to leave me to my own devices for months and months and months. So the hope is we figure it out soon, and I always have my little freezer baby there waiting for me. And the reality is too, even though I have that, like that only has 50% chance of
Right.
actually implanting. So there's just lots of reality kicks when you get to this point too.
Yeah.
So
I was maybe contemplating not having babies.
Totally understandable.
Because it's exactly what you said. It's
Yeah.
very scary, the thought of having babies and then not being there.
Yeah.
And the responsibility that you leave for your loved one.
Yes.
If you're not.
Your
there,
family,
To be
yeah.
a single parent and raise children.
Absolutely
Yeah.
understand that.
Yeah.
So I had some stuff to work through, and I finally am at a point where I feel like if something were to happen in the future, I still want to have babies, and I would want them to know me, and so
Yes.
I would like to start thinking about it. So at my last appointment in October, I asked my doctor what his timeline was, and he told me he wanted me to at least wait 2 years, and it's been 2 years now of me being on the drugs. So he is going to refer me to the fertility, and we'll go from there.
These are hard conversations.
Yeah.
Even if you didn't have cancer, infertility is a very hard thing, and unfortunately, it's very prevalent in our society and with
Yet
young
not
women.
talked about.
We don't talk about it, and
It's
it needs to be
taboo.
talked about.
Yeah.
We need to talk about miscarriages. I've had a miscarriage. It's devastating. So
and
these
it's
are
very lonesome, or you feel
very
isolated.
lonesome, and you
And-
feel guilt. You feel
Mhm.
like you did something wrong. Just like when you get your cancer diagnosis, you automatically think, "What did I do wrong?"
I've been very open about my miscarriage, because when you Google cancer and miscarriage, you don't get much.
No, and it's not one of the good Googles. It's the dark tunnel. It takes
Yeah,
you
but
down.
like surprisingly, there's nothing there, like even dark stuff,
No.
and like I wanted something, and it's
Yeah.
just there's miscarriage and all that, but what about miscarriage and cancer? Like what it just wasn't there.
So I guess the first thing that I should talk about is that my experience is very different than a lot of the I think all of the women that have spoken on this video so far, because
Yes.
I was a childhood cancer. I am a childhood
What's your
cancer.
name? This is
I'm
Ashley.
Ashley.
Welcome, Ashley.
So yes, I'm a childhood cancer survivor, so my story is a little bit different than the other women involved in this video. So I was diagnosed at 3.5 with leukemia, and have been cancer-free since I was about 6, so over 20 years. And I have a 4-month-old daughter named Juniper, who
Beautiful.
we wish she could be here, but she's just camera shy.
She's 4 months
She
old.
doesn't do well. And because of my cancer history and some other health stuff that I have unrelated to my cancer, I was part of the high-risk clinic at McMaster. So basically, as soon as I got pregnant, I was told, you need to be into the doctor, like, the moment you know. So it was, I want to say, like 3 days, and I was at my family doctor's being like, I have this little thing, hopefully, inside of me. I think I'm pregnant.
And what were your hopes and dreams going into your doctor of what your fertility and your pregnancy would be?
Yeah, I mean, we didn't have trouble conceiving, which I was very, very nervous about. We were very fortunate that we didn't have to explore any sort of supports in terms of getting pregnant. But I was worried basically from the moment that I found out that this pregnancy wouldn't be successful, that I would have complications that, you know, would harm my baby. I wasn't so much worried
Or your
about
body.
I wasn't really worried
course
about
you
my own
weren't.
health. I was
You
more
were already a
concerned-
mom.
I was more concerned about little baby inside of me. But a lot of the complications actually were specifically about my own health. So I had a lot. There was concerns about my heart. There was concerns about whether or not I would be able to deliver without sort of without a C-section, like a vaginal birth. She was at risk of low birth rate. There was a greater chance of Down syndrome. There was a greater chance of some other genetic disorders and genetic
And these are
challenges.
things that they were worried about because you had chemo.
Correct me if I'm wrong, but they seem to emerge as the pregnancy develops. So it wasn't like you went in the doctor's office and they had a list and they're like, this is what we're concerned about. It was every visit's like, oh, okay, well, now we have something else to add to the list.
Yeah, I mean, when I first went in, there was like, okay, these are the ones we know we have to be worried about, and we have to do these tests to make sure that all this stuff is okay. But then it was like, okay, we're gonna do. I think I said it was 8 or 10 ultrasounds throughout my pregnancy, which was lovely. Got to see babe so many
Lots of
times.
pictures.
It was lovely.
Yeah.
But every time we had that ultrasound, it was because there was a concern, or oh, that last ultrasound showed this, so now we have to do X, Y, and Z, or these more ultrasounds because of that one. Pregnancy was really hard on my body, but emotionally it was by far the most challenging thing I've ever done, because I was living in this constant state of anxiety of I can't control what's going on, and you know, my cancer that I thought I had dealt with and I thought I had moved to this new place, oh my gosh,
It came right up.
it's so up, it's so present, it's so in my face every day, and I'm feeling this thing grow, and it was beautiful, but my cancer stole a bit of my joy during my pregnancy, I would say.
So for you were hoping to have more of the non-medical side of your pregnancy and your birth, more midwife, more natural.
I wanted to labor basically in our backyard in the forest and give birth with like birds.
But cancer sort of stole that and put it into
It wasn't
a
even a
medical
question.
concept, which you never thought would be what your pregnancy and your birthing and everything.
And I can relate somewhat too, because when I delivered my son, two things were really important to me, and one was skin-to-skin contact, and the other was breastfeeding. And I really didn't get any skin-to-skin contact because he had issues with his lungs because he was a preemie. And then breastfeeding, I could only breastfeed for a month. So I also had these dreams of how things were going to play out, and then cancer was just
Took
like,
it away.
Nope, we're not doing it that way.
And I think as society looks at mothers and mothering and pregnancy, we have those expectations still for mothers, right? I remember in our prenatal class, it was breastfeeding, or that's like, if you don't breastfeed, you're bad.
Bad mom
you are a bad
already.
mom before you even give birth. And I remember thinking about a lot of you gals, and you know,
one breast, no breast.
I have known so many women that breastfeeding is not even on the table because of your cancer. And we never talk about it, right? So how isolating is that to go into these spaces? You have this joyous, hopefully somewhat of a joy left, and we're not even recognizing. But there's some people who, it's not your choice.
And without formula, my son would have died.
Yes.
Like, literally. I struggled with that inability to breastfeed. As much as I struggled with having cancer, it was
a hope and a dream that you thought was going to happen.
Absolutely.
It was
It was
new
as
baby.
an
It was
important
just
issue.
that sort of thing that you thought was going to happen. Yeah. So it was another loss in a sense.
Yes.
Yeah.
And especially when it, as you mentioned, in society, when it's sort of in your face,
Oh,
do breastfeeding, breast is best, and you're like, I tried, and
it's not my choice.
I can't.
And you have to do what's right for you, and you know, sometimes your body has different plans than what your heart and your mind had, and you have to reconcile that, which can be really shitty. Am I allowed to swear in this video?
Yes.
Yeah. It can be super shitty. And my husband actually said something to me that stuck with me, so I said, we've been talking about it. He's not convinced that we want to. Who knows, right? Like, again, our bodies may have different plans.
And life changes and your wants change.
Yeah. And he said that he's not sure that he could go through it again because he was always so scared that I would die in childbirth.
Of course, because you're his world, right?
Yeah, and I mean, the way that those doctors bless their hearts and they're doing their job and they're doing it well, but the way that it comes across is it's really scary, right? And so we would go to these appointments, and I'm so thankful that Taylor was able to come with me to all of my appointments. But the things that they were saying to us, it's like, okay, like, am I walking around with a ticking time bomb in me? Is this really worth it?
And it's supposed to be a joyous time,
Yeah.
and every, we're at this stage now, and every stage for
Exciting.
you
Yeah.
was
Yeah,
scary.
it was really scary.
Very scary.
And you two talk a lot about looking well, right? And we
Yes.
talk about that a lot in our
You look
Pink
too
Pearl
good to be
community.
sick.
Mm-hmm. And that's always been my thing. I look great. I look great, right? I look healthy. I don't look like I have any sort of chronic illness. And when I was pregnant, I got that a lot, especially at work, right? So I'm going to work and I was carrying all of these like anxieties and worries, and nobody knew really what was going on. And even trying to explain it to people, I was like not really able to put it into words. I don't really want to get into it all, but that image of like, you look fine. But I think we could do a better job of like supporting people and walking them through that process with these really big life-altering moments,
And
right?
reminding people maybe that it is still a joyous thing. You're bringing new life.
Yeah.
This is a happy thing.
And like, you're not just another chart.
Yes.
You are a person. You are a person with a husband.
not just a patient.
So you have a partner, you have these goals and these hopes and these wishes for your life as a mother. And something that Taylor talks a lot to is that when we would go to these appointments, we would see different doctors pretty much every...
Right, different specialists.
That's
different,
tough. Because then you're re-explaining things over and over again.
Yeah.
To people.
And they wouldn't talk to him. They wouldn't really look at him. There was only one doctor that we can remember that actually like acknowledged his presence.
He's a parent. He is the part of this
So that was good.
child.
And so for me, I always say like being on the other side of the table or whatever you want to call it.
Right.
So not being the one providing advice or giving like the medical info, how that's given me so many more perspectives, right? So like making sure you're, I don't know, talking to not just the patient, talking to their partners or their family. Yeah.
Well, thanks so much.
Thank
for
you so
sharing.
much for sharing, Ashley.
This was episode 6.
Yes.
What to expect when you're not
Not expecting cancer.